back with Barb from Dover Apothecary. We're talking optimizing aging, which is kind of probably pretty critical for me and you, Barb, because, we're not as young as we once were. And I do want to talk to you a little bit about your little bump on your head. It's not just a little bump on your head. And I want to talk about that after, because I think people need to understand a little bit more information about concussions. By the way, Barb, this is Dave, okay?
Okay, thank you. Can you spell that for me, please?
No, some days I can't.
Okay. All right. Well, thanks, Dave. So today we are talking about optimal aging and the balance that we need to find in our lives. And I'm wearing green today. I'm wearing green because I'm really, really glad to be on the right side of the grass. That was quite experience. And it brings us back to our topic of what we need to be doing for ourselves to age optimally. It's not just about the nutrition. There's a huge component of being mindful in our activities. And that's what this has reminded me of, is when you're doing something, you need to be focused on exactly what you're doing, not getting distracted by other things. Because if you injure yourself, the recovery period takes a lot longer. Not impossible by any means, but we do have to step up the nutrition and make sure we're getting adequate rest, make sure we're drinking enough, getting the right type of physical activity, and knowing when to rest is huge, especially when you're recovering from any sort of ailment or injury. So, oftentimes we can get away with a balance with our health of about 80% of the right choices and 20% of, some treats, some indulgences, things like that. But during a recovery phase, it's really, really important to bump up the nutritional components of our diets to, closer to that 100% for that process of all of our metabolic functions coming back online, all of the hormone balances, reducing inflammation in our system, things like that. That's what really optimizes our ability to recover and to go into optimal aging processes. And I know you've had a few of your own challenges as well. Most of us have.
In your scenario, and we're talking about it, for those that don't know, Barb suffered a concussion recently. And I think there's you and I talked off air. I mean, growing up playing hockey, I know I had a few, and it was always, you got your bell rung, and that's kind of the old mentality. But the new mentality is really good because it takes a lot longer than we realize, like you just said, to heal in that scenario, to have the proper healing time. And I think we need to be more aware of that, especially, talk a little bit about what you found. I mean, yours was, you tripped and you fell, but I mean, the components that went on after that, right? That triggers other things from that concussion. Maybe you could talk a little bit about that.
All right. Well, it's not the first concussion by any means. This is at least number 8. And I've recently gone for a brain scan that I've paid for out of pocket because I was not feeling myself at all this time. There was something vastly different. Other concussions, as you said, it's like, I really rung my bell. I saw stars. It hurts for a minute, but you just, the part of your brain that's responsible for, your fight and flight response, especially if you're involved in sports, right? That adrenaline just carries you through and you don't realize that there's actual damage done. And so in this case, tip for everybody, do not pull your lawnmower backwards down a hill. It's just gravitationally, all the laws of nature, the laws of physics, and just really 100% stupid. So, hit one rock, head hit another rock. Every vertebrae was shifted, compressed from T1 to T8, whiplash, as well as, the staples in the head. And so this brain scan was really, really interesting because it showed all of that residual damage as where exactly those concussions had taken place. Apparently, as a child, I had actually fractured right across my skull. So the doctor that was doing the scan is like, "What did you do here? What did you do here?" Um, it was really very fascinating to see all of that, but to understand now going forward that if I want a full recovery, then I really have to, educate myself because we all get frustrated with trying to get the help that we need out there. And ultimately, it's 100% in our hands to be the ones that are driving that. And it's hard when you're not feeling well, right? To have the wherewithal and the resources to make sure that that happens. But there are specific supplements that are critical for your brain health, understanding the area of the brain that's being most compromised and getting that balance of rest. Because science is always changing, right? The way that we learn about things, concussion protocol is nothing like what it used to be. You know, Several years ago, they wanted people just to rest, to stay in dark rooms, to this, to that. Nothing about that felt right to me. I was right on there doing my wordles, but in very limited periods of time.
Right.
Listening to your body when it needs to rest. I've never been somebody that's napped, but almost every afternoon I feel like I need at least a little bit of quiet time, if not out and out sleep. And it's my body thanks me for that. I can feel that recovery process is coming along. But this has been a sobering experience, and so I'm making sure I'm getting lots of my omega-3s because they're anti-inflammatory. They nourish the brain. I'm educating myself on the different supplements, the different fuels that are happening within our brain, the cycle of our ATP energy in the brain and how that cycles through with concussion. So it's been crazy fascinating. I've popped on a few webinars that have been nice and short, taken lots of notes. So if somebody is having post-concussion sort of symptomology that's not clearing up, I'd be happy to have them reach out to share, some of these links with them so that they can maybe get the help that they've been looking for so that they can proceed forward with their recovery. Being treated for whiplash after a concussion apparently is a critical factor. They say that with every concussion, whiplash occurs. And one of the other really interesting things was that, we think of the brain as being more solid, I guess. The skull itself, obviously, is very, very hard, but the brain itself is more like jello. And
Yep.
so when we get concussion, it's actually the stretching of the synapses and neurons that's causing all of the damage and getting that bowl of jello to stabilize again. But that's where the nutrition comes in, and that neuroplasticity has to really, really be readjusted, but with the right therapist and all of the right help. So it's been very, very interesting, a great reminder for myself that balance of that 80% fuelish, and by fuel, I'm talking about our food. Our food is our fuel, and we have fuel that's good for us, and we have fuel that damages us. So
Yep.
if you want more for yourself as you age, because I want to be a healthy grandma. I want to play with my grandkids. I want to do a lot of different adventures with my husband. Over the next, we've been together for 42 years, married for 39 this year, and really want to make sure that we have the type of lifestyle that we've been planning on when we retire.
Two things. First part, signs and symptoms that you had. And I like that part that you said if someone's going through it to reach out. The other part is they may not know they're going through it. So if you're a caregiver, a partner, be aware of these signs and symptoms as well, because they might just seem a little off, but that could be a concussion. So let's talk to that. What were I know you would know, but what were the immediate signs and symptoms that hit you?
Well, that head hitting the rock and the sound like my right ear blew out, and of course the staples.
But I mean,
those physical.
were you dizzy? Were you out of sorts?
Totally out of sorts. Totally and completely. The first 3 nights, I could not sleep. My entire system was so hyper excited. There was so much, because of the amygdala of the brain and the limbic system, there was just so much discoordination. I felt like my entire spine was a live wire.
Wow.
And everything was just jangled, so I could not sleep. And I'm thinking, okay, how am I supposed to get better if I can't sleep? But apparently that is a really, really normal cycle with concussion. And that hyper-excitability, that hyper-arousal. And so the brain thinks everything's wrong. So you've got, it's things just
overloading.
going.
It's overloading.
Totally overloaded. And then around day 3, that flatlines. You run out of ATP, and there's not enough of the building blocks and so that's when people oftentimes sink into a depressive state, not necessarily depression, but that can be part of it. That's when the moods start to get a little bit. That's when I found I was some days a little more emotionally affected, a little more weepy. My husband has said to me, a couple of times, like, you just seem off. You just don't seem quite yourself. When I'm doing my thing, when I'm being professional Barb, I find that I'm, but a little just off center otherwise.
Is there a lot of clutter in your thought? You know what I mean? Like, it's all right. Usually I know you're very good at multitasking. And does that sort of go away because all of a sudden you can't put that thought process in order? I've heard that from other folks that have struggled with concussions, that thought process just doesn't fall back into place as quickly as you'd like.
No, that is correct. And that squirrel syndrome, as I call it, is definitely, I really have to bring myself back to that mindful state. And, that's going to be a reminder going forward to myself, is if I'm invested in something, slow down, be mindful. But yes, that the focus, the concentration definitely has shifted a little bit. It's getting better. There's been a lot of nauseousness. I couldn't eat that first few days because the vagus nerve, which is a really, really hugely important nerve for almost every function in our body, but it controls our digestive processes. And so that was affected. And so I simply couldn't, even the thought of eating was just, nothing was going to go down or stay down anyway. And the one thing they said is you must not vomit. If you vomit, you need to get back to the hospital right away because of the pressure. And so that, it was just a slow down phase, a really step into even more mindfulness about my nutritional aspect, making sure that I'm resting, but also getting enough walking activity. But the moment you feel like you're starting to get a headache, that's when your heart rate starts to go up. So it's really important to know what a safe heart rate is for you. And if you feel it's elevating, even because you're walking up a slight incline, maybe you're walking up the stairs, if those things bring the headache on, that's what I've been told is that's your cutoff line. That's where you stop doing that activity, rest for a little bit, but you keep trying to extend past that. And gradually you bring your physical activity up. There's something called a buffalo treadmill test that some of the therapists will do with their patients, especially when things are, not recovering the way that they should. So, yeah.
It's interesting. I think, too, a lot of people I had a family member who struggled with, had a motorcycle accident and struggled with some trauma, and a brain injury can take up to 2 years to heal easily. And I think that's the other part that folks kind of forget. So in that time frame, you can deal with mood swings, you can deal with depression, you can deal with the headaches, you can deal with anxiety. And, this is a great topic to discuss because I don't think folks really understand what a concussion can do, long-term effects. And I want to thank you today for talking a bit about it, because it brings it to light, especially with, with young adults that are athletes and kids that just, we just can't brush those off anymore. We have to take a serious look. And you explaining it too, just the way you did, simple thing, cutting the lawn, right? It can happen to anyone. So, I just banged my head. Well, maybe that secondary thought process should be seeing what else went on there in the process. And I know not everybody can just, I'm probably the atypical male. I'm okay. I don't need to go to the doctors, but be aware, like you said about the signs and symptoms, those characteristics are telling your body's telling you something. So listen. Great topic today, Barb. I got to thank you for bringing that up. And I hope you get feeling a lot better, because, we need you to remember who I am so we can keep this show going. Okay.
That's for sure. And it's a good day to have a good day. Take care of yourself. And, if you yourself or a loved one have been affected by concussion, please feel free to reach out. I'd love to talk to you. If it's mood changes, if there's anything in the nuances of your loved one or your own personality that has been recognized to have been changed, there may be some help for you. Thanks, Dave.
Barb's at Dover Apothecary. When you're healthy and you get back, we look forward to seeing you there. And can you give your website or your email address if folks want to get a hold of you?
Email is barb@healthywellandwise.ca.